After surgery, you will be brought by the anesthesia and surgical team to the cardiovascular intensive care unit, or the CVICU. The CVICU team members will begin taking care of you the moment you arrive. This group consists of a provider from the critical care team, your cardiac surgeon, your nurse, a respiratory therapist, and a critical care tech. You will be your nurse's only patient for the next few hours. Nurses in the CVICU have received specialized training in taking care of patients after open heart surgery. Your nurse will monitor your vital signs and make adjustments to medications to help control your blood pressure and pain. You are in good hands. After the team has settled you in and you are stabilized after surgery, your family will be able to come up from the family center to see you, even though you will still be asleep. After surgery, you will have several lines that we use to monitor your vital signs. You will have a breathing tube connected to a ventilator to help you breathe. It is our goal to have you weaned off the ventilator and breathing tube removed within 6 hours of your arrival to the ICU. This is called extubation. You may experience discomfort during the weaning of the breathing tube. We will do all we can to provide you comfort during this time. In order to keep you safe while you wake up from sedation, your arms will be restrained. Try not to be alarmed when you notice this, and remember, it is just for your safety. Once you are fully awake and calm, the respiratory therapist can remove the breathing tube and the restraints will also come off. You'll also have something called a central line, an IV which can be used to give IV medications, as well as monitor the pressures in your heart and lungs with something called a pulmonary artery catheter. You may be on medicines to help raise or lower your blood pressure, as well as sedating medications, which will be turned off as we wake you up after surgery. After open heart surgery, patients have chest tubes in place to help drain fluid from the surgical site. Most patients also have temporary pacing wires, which can be used to manage your heart rate if needed. It is important for us to keep track of how much urine you're making, so you will have a tube to your bladder called a Foley catheter to allow us to monitor urine output. Activity is very important to your recovery after surgery. After your blood pressure and other vital signs are stable, your nurse will start helping you to get moving. You'll begin with sitting at the edge of the bed the night of surgery. Starting activity early on helps make it easier to cough, take deep breaths, and use your incentive spirometer, which you will use throughout the rest of your hospital stay. Your nurse will help you get up to the chair in the morning after surgery. This first day after surgery, you'll also work with a physical or occupational therapist, another team member who will help you get one step closer to home. The therapist will also teach you how to increase activity and protect your incision following surgery. Physical activity and mobility are a vital component to your recovery. You should expect to be out of bed for every meal and walking in the halls at least 4 times a day, starting the day after your surgery. Our staff are trained on how to help you ambulate with the drains and devices you may have after surgery. Pain control after surgery is important, especially so you can participate in activity. After heart surgery, you should expect to have some pain. Our goal is to manage your pain. We might not be able to get rid of it completely, but we do want to get it to a tolerable level, so we will work together to reach that goal.